Good morning, everyone. I'd like to welcome you to the Community Health Training Institute webinar on improving community health through local policy change. We're very excited to have this webinar today brought to you for free, thanks to the Department of Public Health here in Massachusetts. My name is Gina Rodriguez. I'm the project manager for the Community Health Training Institute. As I said, we're very excited about this presentation. It will be brought to you by DJ Wilson from the Massachusetts Municipal Association. And I just wanted to give you a few pointers about how this webinar is going to work. If you have any questions, please feel free to type them into the chat box. We will be able to answer them if you're having any audio issues or you can't hear us or there's a lag in your screen. Please feel free to type in. We'll answer any questions. There will be times for questions during the presentation, so feel free to, again, write them in the chat box, and if you have any anything that comes up, we'll be happy to answer those questions. We would encourage you to use the hashtag. We are on Twitter, hashtag MACoalitions, and feel free to tweet us at HRIA Institute on Twitter. Again, box, this is what it looks like. If you have any questions, please feel free to plug it in and give us a couple seconds, and we're going to switch over to DJ, who will get us started on our presentation.
Good morning, everybody. And I just need to, oops. Good morning, everybody. My name is DJ Wilson. I am a lawyer who works on basically two issues at Mass Municipal Association. That is tobacco control, which I'll use a lot as an example, and also the state's Mass in Motion, which is basically the anti-obesity program trying to improve nutrition and get people. So just as a, oops, what I can't. Just as a note, I know that there's people on today who are from other states, and all states have a Mass Municipal Association equivalent, except for the state of Hawaii, and a lot of times those are called leagues, and so they may be helpful in you promoting policy in your communities across the country, and they're oftentimes called leagues. It's either municipal associations or a league. So learning objectives today are to be able to define what a PSE, Policy Systems and Environmental Change, is, describe local PSE change examples, and to identify key components and strategies to incorporate these in your own community initiatives. So just a quick question. I'm just curious if anybody on today is a currently or previously elected or appointed official. If so, it would be helpful to know what you are, because you may be helpful in filling out the webinar. So the first slide, this is a slide that comes up a lot for people who work in public health. Tom Frieden, who is the head of the CDC right now, but I assume will soon not be within at least a month. He came up with this when he was the health commissioner in the city of New York. And so what it really goes to talk about what we do here, and the whole pyramid is very helpful in promoting public health. But you'll see at the very top of the pyramid is really one-on-one counseling and education. And what we have found over the last 24 years of me doing tobacco control is that we want to go down to the fourth down, changing the context and socioeconomic factors. And those are the places that we start seeing policies go into place that make a big difference on a broader number of people in your community, and that the change often is more likely to stick, basically. So in Massachusetts, we know that we have a smoke-free workplace law that bans smoking in workplaces, bars, restaurants, and we know that it has now been in effect so long that there may be some fiddling around the edges of that law, and we always are are fighting the good fight to make sure bad fiddling doesn't. But in reality, we're never going to go back to having smoking restaurants and people smoking in their houses in Massachusetts. So when you get down to that largest impact, the bottom two, that's where it really makes a huge difference in improving public health. So this is a quote that comes up a lot as well. It is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. And that goes from just having the jar of M&Ms at the front desk in your office. It can be that difficult to make those changes. So we have a lot of things out there, just because so much out there that is working against us to be healthy. So policy can have multiple meetings. It is the system of laws that a government or other governmental entities, sometimes they're not so necessarily cities, towns, counties, and states, but also there's a lot of airport authorities and that kind of thing. It's a system of laws that these entities use to chart out their course of actions concerning any given topic. They can be voluntary, so a work you might have put in place that Fridays is denim day, that you can wear jeans, but no one ever wrote this down, or mandatory, and the range that I have here as the examples are a local park and recreation rules that are put together by your recreation department about who gets to use the ball fields in the middle of the summer. School district handbooks set by school committees, and then going up the ladder at the local level would be those ordinances or bylaws that happen in cities, towns, and counties. Just as a note, I probably have this further down on a slide, but I'll say it now. Just as a note, if you aren't from, for people who live beyond Massachusetts who are on this webinar, Massachusetts has an extraordinarily weak county system. So we don't do much by counties, but a lot of what I talk about today will be easily transferable from city-town governments to county governments. So Black's Law Dictionary, talks about what a resolution is, and that's a formal expression of opinion by a public assembly adopted by a vote. It has no force of law, but it can be sometimes an important step in creating that first law. So early on in tobacco control, when we started this program in Massachusetts, it was the years when people smoked in grocery stores. So the first step, just being able to get a city council to agree to a resolution that it is unhealthy for high school kids to smoke, was an important first step. We've gone way beyond that now in Massachusetts, but sometimes these resolutions are important first steps, but they don't have any force of law. Then the local law that we do have here in Massachusetts is pursuant to the Massachusetts Constitution, which does allow, it's called Home Rule. It does allow cities and towns to pass any policy into place that is not prohibited by the state government. That's not an area of law that the state government takes over. And also in Massachusetts, we do have this unique ability to use boards of health to make health regulations. There's only a couple other states that have this as well. So every city and town, we have 351, have to have a board of health of some sort. Sometimes that may be called a health commission in your city or town. But under that Board of Health actually has rule-making authority under Massachusetts General Laws, Chapter 111, Section 31, and it's pretty simple how it's an easier way to pass a regulation as long as there's a public health component, and we'll talk about that as we go on. So those are the two basic ways that a city or town in Massachusetts gain their authority to make local policy. So why do we focus on this? It institutionalizes the change. Like I said earlier, we're never going back to smoking restaurants or smoking offices in Massachusetts because it really has changed the playing field so much. We're never going to go back. We're never going to go back to a day where cars are made without seat belts. And how did we get there? It was a long fight for both those issues, but it started with being evidence-based. That is a popular term in public health, and it is an important term, but we recognize that sometimes when you're the first town to go forward to do something, there's not going to be much of an evidence base. So it is something that should have an asterisk after it, that not every time will you have something be there. So in the early years of tobacco control, we did have a lot of youth groups that sought to ban tobacco vending machines. And, you know, we knew, we heard hearsay that kids were getting their cigarettes from vending machines down the dark hall near the bathrooms at a restaurant that no one was watching. But we never were 100% sure, but it made common sense to a lot of our local officials. So even though we didn't have the evidence in place, they did move on it. And lastly, it's population-based with a broad scope, so it affects everybody or nearly everybody when you make these kind of laws. Local laws are, for us, have been easier to pass. We knew that the professional lobbyists in Massachusetts show up at two places. They show up at the Massachusetts Legislature and Boston City Council. Our other 350 cities and towns are smaller, and so it doesn't usually warrant a team of guys in black suits showing up to talk about local policy. But so it is helpful. We do not have fantastic luck at the State House, our Massachusetts State House, in getting state bills passed through because the lobbyists are well paid and know what they're doing, and they work behind the scenes. And I should, as a disclaimer, Mass Municipal Association also has lobbyists, and your local leagues all probably do as well. So you know, early on we knew that when you went before the Malden, is a city north of Boston where I'm speaking from and live, when you went before the Malden Board of Health, the last and least helpful thing was to stand up in a suit and say, I am from Philip Morris and I don't like this. Malden Board of Health just wouldn't care. And so those professional lobbyists have far less power at the local level. The local policy laws usually get broad community support because they're enacted by local officials who live in the community and understand the community. And compliance rates are often higher. You know, we all have instances where we know of, you know, maybe a federal law or a local or a state law that has been put in place but has never been enforced. There's no money for enforcement. There's no enforcement personnel to handle it. But at the local level, people who live at the local level are more likely to complain when something is not enforced, so we get better enforcement. So the foundations to local policy would be a clearly defined issue or problem, strong, credible documentation of the issue or the problem, that it's evidence-based, that has diverse, broad-based community support, and feasible objectives and goals, and enforceability. And so to walk into a local official and talk about your issue, be prepared that just, you know, getting people to walk more is, they're going to say, okay, that's great, then what? And so, you know, really clearly defining what you want is going to be helpful. In my instance I just used, having documentation of an issue or problem, you know, a city map showing where the schools are, where they're on sidewalks, where school buses pick up kids, you know, that kind of thing would be helpful in figuring out how to increase walkability. Evidence-based, you might be, you know, we have data on this issue. We have data from the state of Massachusetts that shows where pedestrian accidents and bike accidents occur, so you have some evidence there. You'll probably get diverse, broad-based community support because people, even if people don't have kids in the school system or don't walk themselves, well, we have found on this issue, sometimes the local officials who are going to be helpful, that you want to be helpful for you, are those who drive everywhere. So the fact that there would be less cars on the street and maybe less school buses on the street is a backdoor approach to getting that community support. And then feasible objectives, you know, making sure that's practical. You may be able to go back, and you may have to go back and improve this measure down the road. We've been lucky in tobacco control because we don't actually, in looking back over the 40 or so policies we have in our model regulation for cities and towns, most of them get passed, you know, with the wording that we offer. And so there's not much compromise. And so in a way it becomes too easy. We've had this argument that can become too easy because we're trusted in tobacco control to give them a policy that's well written and defensible in court and enforceable. So that has been good for us. But also in tobacco control, they somewhere in at Philip Morris they're coming out with some new product that we don't know about, and we constantly have to go back and improve our regulations as products change, sales tactics change, as we expand our no smoking from restaurants and bars and workplaces to public housing now is a new area for us. So you do constantly have to realize that your objective right today, you may get only a part of the pie, but you can always go back, and we'll need to go back to upgrade it as time goes on. So here are 11 key elements to policy work: a shared vision, community assessment and information gathering. This is much easier to do today than it was 30 years ago with the internet. So you can find out where your mayor went to college, your city council president goes to church, all the groups that your school committee chair belongs to. All these things are on the internet, Facebook, Snapchat, wherever else. And so that is much easier than it was certainly pre-internet. Coalition development, be aware of who in the city would be helpful to you in promoting the policy that you seek, and sometimes those are kind of non-traditional groups. Policy education, getting ahead. You want to be the one who starts the education ball rolling with what you think is good about the policy before the opposition takes that ball away from you. And community education. Educating decision makers is obviously very important, and this is number 6. Really is the big bulk of what a paid registered lobbyist does. They educate decision makers. They build relationships with decision makers, and they become their go-to person on a set of issues. And those local officials or state officials rely on these lobbyists for information. So it's important for us who aren't professional lobbyists to do basically the same thing, and that is introducing yourself to these local officials, building a relationship with them, finding commonality, and then educating them on the issues that you are interested in. Opposition research, again, much more helpful with the internet, but certainly in tobacco we have come across interesting names, organizations. National Smokers' Rights Association, we knew what that was, but there's certainly Americans for a Better Future kind of thing, and you need to really scratch the surface because they may be your opposition. Media outreach, understanding compromise options and how far you're willing to go. Public hearings. In Massachusetts, our city councils and select boards and town meetings all do understand how to do public hearings pretty well, but our smaller boards are not as savvy at that. So you actually might, you just have to be nimble and be prepared that a public hearing may not be as formal as a city council hearing. Post-enactment strategy, it's great to pat yourself on the back when it gets passed, but then the real work starts when a policy goes into effect and how it's going to be enforced and how you're going to deal with any backlash is important. So I should probably have had this slide further up. So we've been talking about Massachusetts municipal makeup for those who are on the call and from out of state. Feel free to ask a question if this is not being, if we are not clear to you, but I'll try to be, to make sure it's basic, or not basic, but amenable, usable for you if you're not from Massachusetts. So here we go on local government structure in Massachusetts. We have, as I said, 351 cities and towns. 55 are cities, 296 are towns, and we do have 14 counties, but in Massachusetts it's really, their limit is to criminal justice. That's where you get your jury duty from, notice from. That's where you get, you vote for a sheriff at the county level, but our counties in Massachusetts generally don't make that many policies. How many of you have met with any or all of the following elected officials? mayors, city councilors, town selectmen, which health directors, school superintendents, and in that city council selectmen would be also, if you have a council board, a county version of those.
So please answer the poll. So choose one, and as the answers come in, they will sort of let us know as you're voting, and then we'll show the results once the poll is closed. So we'll give you a couple minutes to answer. All right. We're ready to close the poll. Thank you.
So this is great to see that people have been out there and talking to people, especially the health director. It's good to see so many people talking to the health director. In part because they're actually very approachable. I think people are always wanting to talk to mayors and city councilors, but health directors probably get less attention, so they're much more welcoming if you want to make an appointment with them or establish a relationship with them. So that's great to see. So the format in cities here in Massachusetts is, and this is the first bullet is true across the country, is that mayors are either strong mayors or weak mayors. It has nothing to do with how physically imposing they are, but it has to do with the breadth of their authority. And so, a weak mayor would be in Massachusetts someone like Worcester. In Worcester, the mayor is the top vote-getting city councilor, and they are given a staff, an office. They control the agenda. They do ribbon cutting, but it doesn't go far beyond that. Whereas a strong mayor usually sits on the school committee, has a lot more appointment privileges as to appointing department heads and staff throughout the city. So a mayor leads the city in Massachusetts. We have a handful. We have one city that exists without a mayor on purpose, and that is the city of Chelsea. And then we have about 5 hybrid, maybe even a little more, hybrid cities that go by town. They got rid of town meeting. They switched the name of their town council, their board of selectmen to town council, but they don't have a mayor as well. They have professional city or town managers. So, but a typical city has a mayor, then a city council. Sometimes they're called board of aldermen. It is important to know that, not surprisingly, out of our 351 fiefdoms, they all have little quirks to them, and so sometimes they are called something else. So it's important to know that. It would be not great to speak to address an alderman as a city councilor. It would show that you didn't do your homework. So just be aware that there are differences. But the city councils vary greatly across the state, but they generally run 7 to 13 members is the size of most of them. Most cities and towns have some kind of combination of councils at large that run citywide and have ward councilors as well. So in cities, we enact ordinances. Ordinance is the name of the law, local law, and that they are authorized to do so through the Home Rule Amendments, the state's constitution. And then and once that goes into place, that's it. There's no, the pushback other than political would be legal, and that would be someone challenging the city ordinance in court. General staff is a chief of staff or a city manager. A lot of times that these would be the people that you would, if you were to make an appointment with a mayor, a lot of times you would get shuffled to meet with the chief of staff or city manager. Don't feel that you're being defeated. These are the people who actually do a lot of the hands-on day-to-day work, and they'd be important people to work with. Generally, mayors set up a bunch of task force on one here in Massachusetts on walkability, and it is the privilege of the mayor to set those up. and to fill them with people that he or she sees fit. And the legal representation in a Massachusetts city is called a city solicitor. For towns, it's a 3 or 5 member board of selectmen that the staff, the town manager, answers to. The town manager is a professional manager, and sometimes they're called, the strongest town manager is called town manager, the next down is town administrator, the next down is executive secretary. And though they have, and that has to do with the breadth of their job duties, with town manager having the most. And they all, we at MMA have a trade association for them, for the state, but their national version is the ICMA, International City and County Management Association, I think what it is. ICMA does have a helpful website, and they do a lot on public health, and maybe a place that you want to go check out. Now, through the Home Rule amendments, towns can pass bylaws through town meeting. We have 260 towns that have an open town meeting where any resident can go and deliberate and vote, but we do have 36 usually larger towns that have representative town meetings where people vote for a representative who goes in their stead to town meeting. All residents could go and watch, but only those representatives can vote in those 36 towns. One big difference for bylaws compared to ordinances is in Massachusetts there was at some point in our colonial past a reason that the legislature did not trust towns but did trust cities. So a bylaw has to be approved by the Massachusetts Attorney General before it can go into effect. She gives it a go-through, a review to make sure it's constitutional. Generally, she will side with the town because there is this gravitas that town meeting approved it, but there are times that they refuse it. For example, when Massachusetts, when medical marijuana had just been passed by referendum in Massachusetts, we had 2 towns. One said we want to delay any opening of a medical marijuana dispensary for 6 months, and we had other towns who said we don't want the dispensary at all. She came back and said, nope, the referendum question said you can't ban them completely, so town B, I disallow your bylaw, but town A, a 6-month delay is perfectly normal. And this is a sample of administrative offices, boards, and commissions that exist in cities and towns. It varies greatly just depending on the size of your city or town. In Massachusetts, there are a couple that are required. A city town clerk, I think, is required. Treasurer would be. I know that a Veterans Affairs person is required in towns. But this is so depending on the policies you're working at, some of these are going to be helpful, some of them won't be. But I would encourage you to think broadly about this group because they may, interestingly, be very helpful to you. In my much earlier example about increasing walkability, the forest tree warden actually may be important to you if there's huge trees that are whose roots are slowly destroying the sidewalk. You know, it's something that you may not think about. But so this is a sample. If you go to your city or town or county website, I'm sure it lists a lot of these things already. So municipal websites are very helpful. For public health, the more relevant local departments are listed here. Certainly the Board of Health, especially with the rule-making authority they have in Massachusetts, is very important. ZBA, Parks and Rec, Public Safety, all would be helpful if you're working on smart growth or complete streets issues to improve walkability, improve the built environment in your city or town for walking and biking. Then planning is also important in that issue. Schools committee, obviously, you should become close to them if you're going to be working on school-related issues, if you're working on substance abuse issues, Board of Health, liquor licensing boards, social human services, that kind of thing is very helpful. So boards of health in Massachusetts, in towns, the members are elected or appointed. It varies greatly, but it'll be on the town's website. It's usually 3 to 5 members. I think Salem has 7, which is unique. And the selectman acts as the Board of Health in about, I'd say about 10 cities and 10 towns across the state. In cities, Boards of Health members are appointed by the mayor, and again, 3 to 5 is usual, 7 is unique. Salem being, I actually mentioned Salem. Salem's a city, not a town. The big difference in cities is that one of them has to be a physician. The physician does not need to live in the city, oddly, but we have a couple instances where the physician has their practice in that city but doesn't live there. And simply, these boards of health under that Mass General Law citation I talked about earlier can enact reasonable public health regulations at a regular meeting. A hearing is not required. A summary has to go in the newspaper, and the regulation has to be sent to the state's Department of Environmental Protection. Beyond that, they don't need to do anything else. But politics certainly plays a big part in that next step. We do in tobacco control kind of urge them to have a public hearing to hear from the public. Sometimes it's not worth, even though they have authority, you have to think about, they could bullet right in and just have the next meeting put in the strongest tobacco reg, but are they going to pay the price later on in the media, in enforceability, a lot of backlash? Will the retailers run straight to the mayor? That kind of thing. So even though they have this incredible authority in Massachusetts to put these in place, we do try to temper it, just so it's a reasonable health regulation that makes sense for the community and is enforceable. So health departments, we do have a handful of municipalities in Massachusetts that have this health department instead of a board of health. It does meet that the state's requirement to have a public health entity, and a lot of times it's a public health commissioner is the head of it. It's appointed by the mayor, and that commissioner on his or her own could put in a public health regulation, but certainly politically they defer to an advisory board or sometimes defer to the city council to put it in place. So when I was talking earlier about how would you find out about the terms for the Board of Health, one place to go is the charter, the municipal charter, the city charter or town charter. Not all cities and towns have one, but your city or town clerk will know, or it'll be on your website. And the charter is the structure of local government. It talks about how long the mayor serves, what his duties are, what's the school committee supposed to do. It's all those it's a lot of those commissions, a lot of those groups listed in there. It's kind of the framework from which a city or town runs. It takes forever to adopt one, and it takes equally as long to amend one. So so once they're put in place, it's hard to change. And if there is a change, it actually has to go up to the state legislature for approval. Usually that is very perfunctory, but it is a step that can take a lot of time. Do we have any questions so far?
So if you have any questions, please feel free to type them into the chat box. We'll give people a couple seconds in case you're thinking and marinating on it. If not, we'll move on. All right, feel free to move on, DJ. We don't have any questions. Oh, hold on. Sorry, health and presses. There's a question that came up. So it's 1 second while we plug it in. All right, so the question is, does it specifically have to be a physician as opposed to other types of medical practitioners?
The state law does require an actual physician. So I do know that a couple cities have had difficulty finding one, but it is a physician.
Great, thank you. And then there definitely are people, I should have mentioned this at the beginning, but you will get all the slides after the webinar is over, so feel free to hold those questions. But if anything else comes up, plug it into the chat box and we'll be able to take more questions towards the end of the webinar. Great.
All right. So types of local laws, we talked about ordinance, bylaw already, the health regulation, but there are other types of regulations out there, as I had mentioned earlier, like a recreational department has a regulation, schools, departments, school committees put in regulations in place, and zoning regulations. There are a number of commissions, there are other departments in cities and towns that are allowed to put in regulations in place, either through state law that allows them to, such as the health regulation I spoke of, or in other areas. And then there's other areas where the charter will allow departments to put their regulations into place. An executive order is the fourth method of doing so. Executive orders are something that the president, governors, and mayors typically do. They typically are meant to, they short-circuit the arduous process of ordinances and bylaws or state laws or federal laws, but the limitation is that they can extinguish at the end of that person's tenure as mayor, president, or governor. And we will certainly see in the next 2 weeks a lot of President Obama's executive orders being done away with. So that is the limitation to an executive order. The benefit of it is that it's not only fast, but it's a good way to like a resolution, it's a good way to, first step to have an executive order that, names July Walkability Month or something like that. And for more meatier subjects, it may be a way to put things in place and start having that local acceptance and institutionality happen so that they're less likely to be extinguished when the next office holder comes into place, but it certainly is a risk, and we will be living through that. We'll be living through that in the next couple of weeks at the federal level. So just a practical point of view, city councilors or board of aldermen, when they decide to have to entertain a policy, usually the first step is it goes before the full city council just to be referred to a committee. So a lot of the work happens at the committee level. It's a subgroup of city councilors who belong to a committee, and they are the ones who will edit and play around with the policy, and they're the ones who will probably have the hearing. At the end, if the committee approves it, and it'll be rare, committees will be sensitive, being a subgroup of the city council, as to how the whole city council would vote on this. Because if they approve something, then they don't want to go to their full body and lose. So a lot of times the heavy lifting happens in the committee, at the committee level, and then when it goes to the full city council, it's likely a done deal. So these are harder to amend than health regulations. So we certainly have seen in the past, because some of our cities and towns choose to go one step beyond what our model regulation has. So they wanted to do, aggressive capping of tobacco sales permits locally, and we're fine with it. We try to to craft the best language we can, and it should, it gets a lot of eyes are on it. City solicitors should be looking at it. But sometimes something gets put in place and you go, oh, there's a glaring loophole that we didn't think of, or the wording was awkward and makes it hard to understand. When it's a health regulation, easy to go back and fix those kind of things. When it's a city council, when it's an ordinance, it's very difficult to do so. And lastly, mayors may veto a city council vote, and an override is possible. But again, at the local level, the committee will be sensitive to what the mayor also wants, and they want to see whatever they say, whatever they approve, to get approved by the full city council and then the mayor. Now, sometimes be aware that a couple things may happen here. If you have a good, or I should say bad, relationship between city councils and mayors. Sometimes city councils want to ram through something expecting the mayor to veto it so they can, somebody can look bad in the press. So just be aware that you do not get stuck in that vice between the city council and the mayor. And the other thing to be aware of here is election season. So we in Massachusetts will have city elections in November in almost all cities and towns. Just as a note, some mayors are two-year terms and some are 4, so not every mayor will be up for re-election. And our towns typically have town elections after the spring town meeting sometime in March, April, May. But so just be aware that if you're going for a policy, you may want to position yourself as a election issue, or you may not want to. You may not want to get into that meat grinder of politics. So just be aware of that. So it's a more complicated procedure for town bylaws, and this is why we only have one town actively doing their tobacco control through town meeting, because it's such a pain in the neck to do. So what happens is that a citizen puts an article, which is the policy, onto the warrant, which is the set of policies that the selectmen either approve or that a petition process to circumvent the selectmen has been done. And that petition process will be laid out in the town charter. Typically an article starts off with, to see if the town will ban all tobacco vending machines. And so then you have to be, if you're going to go this route or your town has decided to go this route, then you need to become intimately aware of how the town meeting process goes. So certainly you need to know representative versus open town meetings. The list of, if they're representatives, the list will probably be on the town website, and it'll be long. Framingham, Plymouth, and Brookline are all examples of large representative town meetings. But it's a finite list, so you'd be able to actually go on the list and see if there are built-in allies there who would be helpful to you, or to contact them, or to send them a flyer. So that is helpful compared to the open town meeting, where you're not going to be really sure who's going to show up that night to vote on your policy. Approval is by a simple majority, except for some types of laws, and zoning bylaws is one of them. And as I said earlier, the Attorney General must first approve the bylaw before going into effect. So while it's typical for an ordinance or a health regulation to end with, and this shall be effective on this date, that's not possible for a bylaw unless you put it way out, because you can't because with almost 300 cities and 300 towns going to town meeting at generally in the same couple months in the spring, couple of months in the fall, the AG is then inundated by all these bylaw requests that have to be reviewed before they go back. So you can't. So you just need to be sensitive to the fact that you want an effective date far enough out to give the Attorney General plenty of time to come back with that approval that you have to have. And also keep in mind that if you're working on this policy, and it wouldn't hurt for you to have a discussion with the town clerk to let them know when that Attorney General approval comes back, because it may come back and you may never know that it actually was approved. So your town clerk will be the one to make friends with. So Board of Health regulations, as long as it's reasonable, voted on by a majority. Though I will say, just if you're working with some boards of health, they have this feeling that it needs to be done unanimously. There's no requirement to do so. It's just by a majority vote. And one of the things to be aware of is that sometimes you might have, and this happened not long ago, where there's a difficulty with 3-person boards of any type, and that is if one of your board members goes to Florida for the winter, and the other one has the flu, you can't operate. You can't operate with just one person. So, but what has happened in the past is sometimes you have a Board of Health member who doesn't like the tobacco control policy in front of them, So they just won't show, which is fine. If that's their choice, they just wanted to make themselves scarce during the vote. But then sometimes boards are like, well, we're missing so-and-so, we can't move forward. And like, well, but if so-and-so is purposely doing this, you need to think this through and say a 2 to 0 to 1 vote, where the 1 would be kind of abstention because they're missing, is okay. That makes for law. So it's just something that recently came up in my world, so it's just something to think about. So a summary has to be published in a local newspaper before going into effect. This is something that if the Board of Health has no clue what that means, we have a sample template for them, and the town clerk actually will know what to do about that. Town or city clerk will know what to do about it. It doesn't need to be in the Boston Globe. It doesn't need to be fully printed out. In the glory days of tobacco control, when we had $48 million, we had some local programs that put the whole 10-page regulation in the newspaper. It really comes down, it could be 2 sentences. On this date, the Board of Health passed this regulation entitled so-and-so. It includes these 2 or 3 hot topic policies. If you want a copy, please call us at. Done. And then a hearing, as I said earlier, is not required, but we do highly recommend them just because the fallout from not having a hearing on the other end is just too torturous. And in fact, we had recently a Board of Health cancel a hearing because they felt that the required notification wasn't up to snuff, and it's just easier to say, let's delay this hearing and do it correctly, rather than 3 months from now have to back up and do a revote and be in the newspaper for not properly posting a hearing. So other boards may regulate rules and regulations, as we spoke of earlier: Parks, Rec, zoning, and school committees. They don't have this full force of ordinances, bylaws, and health regulations, but certainly a lot of cities and towns rely on those rules and regulations. I spoke about, I oftentimes get ahead of my slides, but we've already talked about executive orders issued by a mayor. Zoning ordinances and bylaws rely on police power, and the Zoning Act is, we have a state law on zoning, and then so a lot of the zoning that happens at the local level is heavily influenced by state rules, regulations, and laws. But the objectives of zoning, and the reason that you work on this in public health, some of you may be working on this in public health, is for complete streets purposes, and to improve the built environment. So years ago, what happened in zoning is that it was a town in, I think, Ohio, which I'm blanking on right now. But the idea was to separate the tanneries, from the where people lived, and so it was to improve health and to lessen congestion, and it made perfect sense at that time. But now the movement is to try to have people live and work and shop in kind of the same general places. So we're not all driving 5 miles to the edge of town to drop the kids off at school, and then driving 5 miles in the opposite direction to go to the mall on the opposite edge of town. So that's what zoning's all about, but there are several ways, and we now in Massachusetts, by the way, have 2 new funding sources. Complete Streets is one, where the Department of Transportation is funding cities and towns to kind of improve walkability and bikeability and traffic in cities and towns. And the other, which has been around for a while, is the Community Preservation Act, CPA. It's a surcharge on local taxes, and one of the things that you can do a handful of these things on this list through zoning objectives. CPA money can be used to buy land, to open new parks and open space, and to maintain them. It has a low-income housing component. So when it comes to zoning, the public health intersections would heavily be CPA and complete streets. School committees, they can be elected or appointment. They have to have at least 3 members. School districts are autonomous, and then keep in mind that you probably, if you've seen this, you've probably seen it on your ballot that you also have vocational schools that serve several cities and towns. You may live in a town that belongs to a multi-municipal district. School committees are required to appoint school physicians and nurses. Physical records for each child must be kept. Immunization being tracked, and then intervals for physicals is another state requirement for school committees. Their authority, as you can see here, is rules and regulations, discipline, management of schools. They hire the superintendent answers to them. They oversee all the public schools, and they have supervisory control over athletics, equipment, transportation, and then there is a state requirement to have a student advisory committee, and they're supposed to meet at least once a month, and that should happen commonly. In Massachusetts, just as a note, we also have charter schools in every city and town. A charter school is actually considered for a lot of instances, including smoking, as a public school, even though they have their own administration and bureaucracy. And lastly, just as a note, it is pretty common that a local budget, about half the budget for any municipality goes to schools. So they are that school committee has a lot of authority over a lot of money, and sometimes it puts them in competition with either the select board in towns or the city councilor in cities. Parks and Rec is an entity that's helpful obviously for public health issues, and it's in towns. The selectman chooses a park commissioner. In mayor, a board is appointed with city council approval, and their authority is to deal with public parks, makes rules for the uses for playgrounds, ball fields. In Massachusetts, we do have some parks and recreations recreation departments that have made their own rules and regulations regarding smoking on playing fields, beaches, parks. They themselves have done it, not the health department. Housing authorities. Most cities and towns have a housing authority, and it is a board that is either appointed or elected, and they set the policies for how the housing authority is run. There's usually a housing authority director who answers to this board and deals with the day-to-day governance and maintenance of your public housing. We noted here because recently the federal government is commanding, HUD is the entity, is commanding that HUD-financed public housing go smoke-free sometime in the near future, and our state version of HUD, which also has some funding for public housing, is also encouraging those housing authorities to go smoke-free in their public housing developments. So transparency. This is we at MMA. Our annual meeting is coming up, and we always have a workshop on these 3 things, because this is what oftentimes trips up local officials. There's an open meeting law in Massachusetts that all meetings of government bodies shall be open and public, and anybody is permitted to attend these meetings. Open meeting law does not concern itself with the comfort of people who want to go, so they don't need to provide you a chair, but they do need, those open meetings do need to provide that everybody who goes be able to see and hear the proceedings. So in a meeting that is going to overflow the auditorium and there's no way for more people to get in to see it, it's technically a violation of the open meeting law. So what you'll see in this kind of instance is, it's okay to set up some closed-circuit TVs in the cafeteria and have people go there and watch and hear the proceedings. It does meet the open meeting law. So the open meeting law where our local officials get trapped is that they aren't supposed to deliberate on policies outside of the body to which they belong. So outside of an open meeting. So two councilors are not supposed to be talking at a party about policies and who they, how they're going to vote, what the next step should be. It's fine for them to be at the party together, but they shouldn't be talking about this. And this goes to emails as well. So your local officials shouldn't be using emails to the city council, shouldn't be sending emails to each other about policies. It's okay for them to get an email that says our meeting is being moved to Wednesday because of the snowstorm, but it's not okay for them to do that through emails, as it violates the open meeting law, because the average citizen, resident, or the press would not be able to know what's happening. Public records law also, what gets saved, what is open to the public. And the place to go, if you ever have a question about that, the place to go for that is your town or city clerk will know what public records are available to the public and which ones aren't. And then lastly, the Freedom of Information Act, or FOIA, and the verb is to FOIA'd, is a federal law that allows citizens to get a hold of documents that have been produced, documents and emails that have been produced by a municipality on policies. If you are going to FOIA your town or city, it has to be in writing. You have to specify what you seek, and you should be prepared to pay the photocopying fees for to get these documents. So in the past, and cities and towns do have a set number of days that they have to respond to you, but there's some language in there that would allow for hardship for the city or town not having that personnel that would extend those number of days, but they are supposed to get back to you. So in the past, we actually, when Massachusetts was being sued years ago for, I think it was tobacco, cigarette disclosure ingredient, the required disclosure of cigarette ingredients, Massachusetts was sued, and literally the tobacco industry put in a FOIA request for this, and they themselves wheeled in their own photocopiers and sat at file cabinets and made the photocopies themselves. So I'm sure they paid a fee for even showing up. But FOIA is one way to get local documents if you're being otherwise told you can't get them. So the nitty-gritty of educating local officials and decision makers. Again, this comes down to, this is kind of lobbying, and a lot of you on the call have been told, oh, but I work on a grant, we can't lobby, and you don't need. So the idea here is it's to educate. It's a lot of education, but also you should take care to, if you are working under a grant, make sure, understand where the line for lobbying starts and education ends. But a lot of it is just building relationships. So it's like having key supporters. The biographies, like I said, you can get a lot of that online these days. One-on-one meetings is best. I thought, well, it was interesting, just as a little aside. If any of you watched The Daily Show a couple of weeks ago, he was talking about that people should be involved in advocacy, and he pulled out a desktop phone that my grandmother would have had, and he said, millennials, Twitter, emails, Facebook don't make a difference. You have to use this device, and it really is true that local officials, state officials, and Congress are flooded with petitions that people just have to click on and move on, and go on. So they get 100,000 signatures in a day for a federal poll. They have standardized letters that people just have to sign and mail in. But what does make going up the chain of importance would be a phone call, and then number one would be a one-on-one meeting. It's better if you are a resident. If you are not, if you just work on this topic, but you are from somewhere else. Say you work on tobacco control in Malden, but you don't live in Malden, bring a Malden resident with you. Involve key people, so figuring out what those key people are is from investigating how your town and city works, who are the people that are oftentimes at city council, who have the ear of the mayor, those kind of people, and sometimes those people will be unusual pairings. You may find that the faith community for somehow is going to be helpful in improving walkability in your city or town. And lastly, that last bullet is to update, inform, and become the go-to person on that issue. I think this is very important. It is important enough that I think if you are working in a specific city or town on policies and you have identified the entity that it makes sense for you to talk to, say it's city council, select board, health department, recreation department, school committee, whatever it may be, it would not hurt for you to get on their agenda, say, I just need 5 minutes, stand up in front of them, introduce yourself, tell them what you do, who you do it for, and then leave them and say, if you have any questions on these issues, call me. Here's my card. A lot of times local officials expect you to stand there and say, we want you to enact this policy or give us this money. So it is a prime time to get in front of them and just say, I am not here for asking for any heavy lifting from you people. I just want to be your go-to person on tobacco. So if you have any questions or any ideas, come to me and I'm happy to help you with them. And that's a nice first step, especially if you're new to a job and you're working in a new city or town. Just to introduce yourself goes a long way. So the sphere of influence that I have lifted from some other place years ago, but it does talk about the different stakeholders, and this is just an example of what and this will look different in different cities and towns, but this is kind of a generic one, and it talks about if you want to be to have a good relationship with a mayor, looking on the outside circles to figure out where they come from and what they do makes a big difference. Do they have kids in the school system? Where do they go to college? Do they belong to certain clubs? What's their history? Before becoming mayor, what else did they do? What are the news? What news do they rely on? And who's financially supporting them? And I should give a note right here that if you are living in the city or town that you are working in, there is some value to going to fundraisers. I know it's like, oh, I never expected to have to write a check for these people. But if you really do think that a local official is going to be, that you like them, and that you think they're doing an effective job, and you want them in your corner, being a financial supporter yourself is important, but also checking out what who their financial supporters are is also helpful. Oops. What's going on? In that litany of local officials and local people to talk to, are there any other stakeholders that I'm missing that have been helpful to you in your efforts, or that you'd like to start a relationship with? Seeing none come up, if anybody wants to throw in a question about that, we'll get back to you. I'll move on, I believe. Yep. So that one-on-one meeting is highly important, and that's a great thing to seek for. So how to generally have a meeting happen is in the following ways. First of all, especially if you're going to meet, sometimes it's inevitable that you have to meet them in their office. So going to the Massachusetts State House meeting with a state rep or state senator is good. It's great. but just be aware that they'll just be their attention will be turned away from you for some reason. A vote, a call, aides walking in and out. So I would say sometimes it's better to meet with like a state rep or state senator if they have local calling hours. Sometimes it's better to meet with a city councilor, say the city councilor runs an insurance agency. It's better to meet with them at their insurance agency, where not in City Hall. Sometimes you just get their attention is more focused on you if you can do this not in the place that is chaotic around them. So that's number one. So thank them for meeting with you and any prior support that they had. Brief, concise is important. Bring educational materials with you, but be aware that it is going to be very rare for you to get a local official to read a 10-page or bigger report or journal article on any topic. They are, when a city councilor or a selectman pulls up to town hall or city hall for their next meeting, they go to their mailbox and the mailbox is jammed with a couple inches of paper, and that's what they bring to the meeting with them. So they will look at, like all of us, you will go through the easiest stuff first, and then you'll set aside the 10-page reports. So they're just not, it's unlikely they're going to read it. So any education materials, my personal thing is I stick to the 1 page of reading, and if you desperately have to, print on the other side, but really keep it down to 1 page. And you can note that there's a 10-page journal article that will be very helpful. And if they want it, then you can get it to them. And in fact, it's not bad after the meeting to follow up. Throughout the meeting, there'll be some question or some new information out there that you may not be able to answer. Use the opportunity to use that follow-up to thank them for the meeting, and then send them the additional information that may be helpful. It's a nice closing way to end your meeting with them, is to follow up that way. Again, be their go-to person on this issue. That'll get you far, and it'll keep them engaged, and it will keep you educated as to what they're up to. So the message that you want to deliver is clear and concise, factual presentations, identifying community concerns. Those community concerns should be in their dealing with their constituency. So if it's the mayor, it's the whole city. If it's a ward councilor, it's their particular ward. You'll need to know what that ward is and what's going on in that ward. Identify the benefits for the decision maker and community members and individuals. So for example, one example that I bring up a lot of times here, it was very difficult to, tobacco issues are difficult for local officials that aren't on the public health board, because it's just, they invariably get complaints from restaurants that had to go smoke-free, retailers who feel like they're being targeted by enforcement. But on the mass in motion side of the ledger, a lot of times to change the built environment, to improve sidewalks, to add a park, to a rail to trail, those kind of things, one of the benefits is this kind of legacy making. A lot, especially mayors, they want to leave with a legacy that they changed the city for the better. So even for city councils and selectmen, I tell people, what's more important, that you got the rail trail up and running, or that you got your 6th Dunkin' Donuts into the city? And so, a lot of them get that, and so I would say when you're identifying benefits, sometimes it's just that legacy of making the city better and putting it on their own resume, because a lot of them tend to want to climb up the political chain, is important. Now, as I said earlier, follow up with additional information. Even if you walk away and like they didn't ask for anything, think of something, that next step, that next piece of information that will be helpful, just to have that second contact with them after the meeting. Municipal timing, you can see on the bottom, I talked about election season already. But for city ordinances, city councils don't meet as much in the summer as they do the rest of the year. Typically, city councils are like week 1, full city council, week 2, committees, and then that keeps on repeating. So it's every other week is a full city council meeting, and then the alternative one of the committees. For town bylaws, you have to know when town meeting approves. The state requires town meeting to happen in the spring. In cities and towns, they have to have at least one a year, and the website will tell you when that is. It'll also, and then if you, for some reason, want to put a warrant on an article on the warrant, a quick call to the town. If the website doesn't tell you, a quick call to the town clerk as to when the warrant closes is the term, and that's the deadline for adding a policy to the warrant. You need to just be aware of that. So that's spring. But most towns feel like they usually do what's a town meeting in the fall as well, September or October, just because things come up in 6 months that are unplanned for or that were hanging and undecided at the spring town meeting. But it's not a requirement to have a fall town meeting. So as I said earlier, our city councils and select boards, usually if they have a hearing, it's pretty well run, in part because the town manager will most likely be sitting next to them for the select board in those rare. And then on the flip side, your local city solicitor or town council will be there for big policies. I should note, I didn't mention earlier, the lawyer for a city is called city solicitor. The lawyer for a town is called town council, C-O-U-N-S-E-L. But we do it like those hybrid towns I talked about, hybrid cities that have a town council, C-O-U-N-C-I-L. It can get confusing. But lawyers, the town lawyers typically don't show up for the health, for any public health hearings, but they do for select boards and for city councils. So long way of saying that the public hearings between those two entities is usually pretty well timely, but the smaller boards who just don't do that many hearings may need some assistance in actually organizing for the public hearing. So at a hearing, it's outreach for residents to give input. So for your policy, you should be there, but you should also see if you can get some local residents to be there. Know your proposal really well. They may have questions for you, and you hopefully are their go-to person in the audience to answer the questions about the actual proposal. Have evidence-based documentation ready to go if they need it. Track the testimony and get additional rebuttal info to them as soon as possible. In a lot of instances, they will accept written testimony afterwards, and that can be in the form of a letter or an email. And it does provide you a nice time to say, oh, at the hearing, so-and-so said this. It's not true. This is true. Or this wasn't completely fleshed out. Or this is why I'm against. Somebody else brought up something that shouldn't be in the proposal. I keep on hitting something wacky. So here are some examples that I have brought up just to talk through what I work on and just the timely examples. So complete streets, the theory being that it's to encourage municipalities. This is a national term, so nationally planners and developers understand it. But it's to encourage municipalities to routinely design to build or fix their infrastructure to encourage, to take into account pedestrians, bicyclists, public transportation, and cars all at once. And so this is a big enough deal that the state has decided to fund with $12.5 million a program from the Department of Transportation that cities and towns that put this policy into place can go for money, and I think of it as being money that's not going to be used to repave all of Main Street, but what it might do is figure out how to restripe Main Street for a bike path, or to put in countdown heads at intersections so pedestrians know how many seconds they have to cross the street. So I think of it as being, because a lot of our cities and towns think, oh my God, that's not enough money. You know, $12.5 million does not go far in repaving a highway. But we tell them that this is to fund those extras that would have been helpful for pedestrians and bicyclists that you had to lop off the project because it cost too much. And this is to put it back on to finalize it. So before DOT can entertain giving you money, you have to put this policy in place, and so and it has to be approved by the Department of Transportation. So it has to go through the town bylaw, city ordinance, or be an administrative policy. The actual way it's written is that the highest CMO, Chief Municipal Official, has to sign off on it, so it can be an administrative policy by a mayor. A whole local hearing is required, and it has to identify who will be responsible for carrying out that policy. And also has to identify a baseline inventory of pedestrian and bicycle accommodations, but the Department of Transportation does help with those. And to develop a procedure for road repairs and upgrades. A lot of cities and towns already do that. So, but this program was, in practice, has gone very fast, much faster than typical state funding to cities and towns for road repair and road building, and so that's been very helpful to us. But they obviously are giving money to cities and towns, and they have certain requirements. So these are some of the additional things to do, and then once the municipality is certified with a listing of projects that they want to go forward, then they hopefully will receive funding from the Department of Transportation. So what does this all have to do with public health? It gets towards those mass motion goals. To one side of the ledger is to increase bikeability, increase walkability, and this is to try to figure out ways to make our cities and towns less car-centric, and just to start thinking about how you can make some small improvements throughout a municipality to urge to make the healthier choice an easier choice, to make it easier just to walk down to Walgreens to pick up a prescription rather than getting in your car to do so. And so those kind of things that the Complete Streets has been a really successful intersection between our Department of Public Health and the Department of Transportation here in Massachusetts. Another example of a local policy that's hot and acting right now is that smoke-free housing, as I spoke about earlier. So our state smoke-free workplace law does not address housing at all. It was definitely considered the third rail policy that you would want to stay with. There was just no win in the media to make housing smoke-free. But what we have seen is over the years is that the state, especially after the law was first put in place, had a toll-free 800 number that you could call about secondhand smoke complaints. And so in the first couple of weeks, of course, it was restaurants and bars that just weren't doing their job in being in compliance. They got into compliance. The next thing we saw was those, the single lawyer who rents an office in a professional building and was just sitting in his office smoking. We got to them, but then what we started getting were non-smokers who their whole life was smoke-free. The bus, the office, the bar, the restaurant, but then they got home and all they could smell was smoke. And so this has been a challenge for us to deal with apartment dwellers, condo dwellers, and then public housing. But as I spoke of earlier, the United States Housing and Urban Development did direct public housing to go smoke-free. We don't know if that'll stay in place after January 20th, and we have no indications one way or the other. but it has been very successful in promoting public health. But it has caused our advocates to have to go into cities and towns and talk to people that they typically don't talk to, and that would be the housing authority, the housing authority director, talking to people who work in the public housing day in, day out, talking to residents, polling residents. It brought up a whole new world in public health for us to go down this path. But it's been generally successful. We have lots of cities and towns that have undertaken this aim, and even though there are people who complain about not being able to smoke in their own apartments, and it continues. I will admit that it continues to be an enforcement issue, just as people in public housing using their stereo at 2 in the morning has been. It has been a huge success for public health, and we really would never have guessed a decade ago that we would be sitting here talking about the Boston Public Housing Authority being smoke-free. But it did bring in all these, as I started saying, it did bring in all these different issues that we had to think about. And it was, again, it was housing that we just typically had not talked about. Did you want just the buildings? Did you want a shelter for them to smoke on in the parking lot? You're going to let them smoke in the parking lot? The problem here was the variation of public housing was, the physical plant was huge, so it was very difficult to figure out what was going on. But we sat down with these people and really talked it through, and we made great progress. Third, school vending machines was an early goal of ours. And on tobacco, I talked about vending machines earlier. What this has to do is switching out soda for healthier options. But some of the things that we've had challenges with, the machine that is sitting in the basement of City Hall, like who's sitting on that contract that was done years ago? What departments in City Hall actually knows what's going on with it? You may just get a lot of people say, I don't know. The guy comes once the other week and fills it up and leaves. We have no idea what's happening. And so figuring out who owns those machines, who's sitting on that contract, can you switch the offerings? Should you just get rid of the machine it's being used? And figuring out who buys, what the trends are in vending machine offerings when it comes to not only vending machines for drinks but also for candy, and seeing how to minimize the candy machines and putting in healthier options if you can't get rid of it, and what those compromises would look like. So this has been interesting because it for a lot of Mass in Motion people is their first time really talking to school committees and figuring out where these vending machines are, the secret places that they're hidden throughout the city or town that have these vending machines, and if they were used or who uses them. So that third example has been an eye-opener to figure out how a simple vending machine at the foot of a set of stairs, it could take months and months and months to figure out how to either get rid of or improve the offerings in it. Are there any questions?
So if you have any questions, again, please feel free to type them in the chat box. Those were some really great examples, DJ. I really appreciate them. One commenter noticed when you were talking about engaging other key stakeholders, they talked about the importance of knowing and communicating with the admin staff or the gatekeepers to some of these stakeholders, so their chief of staff or the administrative person, and so sometimes they can be just as helpful as talking to your city councilor or your town alderman.
Yes, and I think that's especially true if you go up to the state legislator level. Don't be surprised that you'll be meeting with an aide and not the state rep or state senator themselves. But they have the same pulse on what's happening as the elected official does, and they certainly will report back to that elected official how the meeting went.
One other question that I think came up for me, at least when you were talking in the beginning of your slideshow, you mentioned being evidence-based and how policymakers are looking for policies that are, evidence-based. Are there any best practices when you're talking about evidence-based? It seems like this big thing, or it's just like, oh, we did a community survey. Is that enough to say that we're evidence-based?
Yes, I mean, so evidence-based for, say, the public housing. It's very common for a housing authority to poll the residents to see if they would support a going smoke-free. We are polling, 75 to 85% in favor of doing so, which probably reflects the smoking rate of those people who are against it are the smokers. But it definitely showed that a straightforward poll was not a tricky question that was done locally made a big difference. Now, if you're going to do this polling at the Malden Housing Authority, it might be helpful to say what neighboring cities Medford and Melrose did, because they kind of look like us. It would be less helpful to say what Boston did, because Boston's just considered a big city. Further less helpful would be what Brookline or Cambridge did, because Malden local officials would not see us looking like those towns. And least helpful would be, that the fine residents of the Public Housing Authority in the city of San Francisco, what they came up with. So local is best, but make sure it's straightforward, well done, that you've thought it through, so there's no loopholes. But local data is best. But for example, for another, would kind of get that same kind of evidence from a city of Malden. But you will have to rely on journal articles or state, that the state may have some resources and done some information there. But just be wary and savvy enough to recognize what will be helpful and what really won't be helpful. Like, I don't think it's going to be helpful in deciding how to get rid of the soda vending machines, that in Finland they did something. But certainly making it as local as possible and relatable as possible for local officials is helpful. And that can be your own, your own, like the polling done in local for public housing residents, or just finding really local examples that look like the municipality you're working with. For example, I keep municipal lists on a lot of different tobacco policies, as well as a list for those cities and towns that put in a complete streets policy. I highlight in bold the city forms of government, because I know when a city official reads it, they want to know what other cities have done. Well, all 351 think they're so unique that no one else looks like them. They do know they start looking at the form of government, city or town, and then they do look at those cities and towns that they think they look like them. And so that is important for them that is helpful for them to be able to relate to the data you're putting forward, the evidence you're putting forward, and sometimes they'll have to make that leap that either Medford data is close enough to Malden that we can rely on it, Boston data may be enough for them to rely on, but the more local, the better.
Great, thank you so much. So we are going to go ahead and wrap up the presentation. I want to thank you, DJ, again for everything and the great webinar that you just gave. We want to remind people of other webinars and trainings that we have coming up. On February 2nd, we have our Coalition Quality Improvement webinar hosted and brought to you by one of our staff people here at HRIA. Her name is Karen Arquetti, along with a couple series that we have coming up, our Health Equity series in February and our CHIP series, our Community Health Improvement Planning Overview, that starts in February as well. So please stay tuned for all the great things that we have coming up. Again, thank you so much. This is DJ's contact information. If you have any further questions, please feel free to contact us. And as I said before, the slides will be sent out to everybody that was present for today's presentation. Again, we thank you so much, and feel free to sign up for our newsletter, contact us on Twitter, and use our social media. Thank you so much.